Good morning, everyone. Welcome to Ask the Pediatricians Live. It's a beautiful Saturday morning on the 38th day of March 2019. I am Gwemi Salaboyede, and I'm so excited to be here this morning. My moderator is having some technical challenges, but I think she will join me very soon. So you're all welcome to ATP Live this morning. On the 25th of March, the world celebrated World Cerebral Palsy Day. And so, yeah, I think my Tommy is here now. All right. Good morning, Tommy.
Good morning, Doctor.
You're welcome.
Oh, thank you very much.
All right. Okay, yeah, so Tommy is here. So I was just telling our guests, our viewers, why we are having this topic. On the 25th of March was the World Cerebral Palsy Day. And as you all know, us on Ask Pediatricians, we always like to celebrate those days as a way of creating awareness about some of these conditions, and that is what we're going to be doing this morning. And so you have opportunity to ask your questions, and we'll be here to talk about it. All right, so share the video and share it to your friends on their pages, on their timelines, in groups where you have the permission to do so, so that we can all learn together. Thank you so much for joining us this morning. All right. Tommy, over to you.
Okay, thank you very much, ma'am. Hello, everyone. Good morning. How was the Saturday on your hand? Okay, so our topic today is on cerebral palsy. So share the video, friends and family, call, send text messages, share to your Facebook pages. Let's all come together to learn. Today is an open house. Come ask all your questions on cerebral palsy. Yes, good morning, Madam Kadijat. Good morning to you. Good morning to you. Thank you for joining us, Ifedayo. Thank you for joining us, Farikemi. Thank you, Perpetual. Samuel Adejoke, don't worry, we'll start attending to questions shortly. Just hold on for us a bit. Perpetual, you're welcome. You're welcome. Moderators, I believe you've started sharing and you're at alert for questions that are posted on the
Yeah.
group and not on the video itself. Dr. Gwemi, can you please just give us an overview of cerebral palsy before questions start coming in?
Okay. Thank you, Tommy. So we'll just pause the questions and while we do the overview, then after that we can um, answer some of your questions. So, what is cerebral palsy? It's one of those developmental disabilities. It's one of the disabilities that affects the ability of the children to walk, move, and do a lot of things. So, what we call motor disabilities. I'm trying to deliberately choose my words so that I don't get people confused, because we have different kind of disabilities. The other day we did the Down syndrome. I think last week I was talking about Down syndrome, which is also one of those genetic conditions that can come with disability, but that tends to come more with what we call learning or intellectual disability. But cerebral palsy is more of a physical disabilities, though it can also there could be other conditions coexisting with it, but primarily cerebral palsy is one of the physical disability. It affects the ability of children to move and do things, and usually it's as a result of a injury or what we call an insult to the brain, actually when the brain was still developing. So when the brain of the child, whether the child was in the womb or when the child was born or shortly after the child has been born in the first few months of life. So those any injury affecting the brain can result in cerebral palsy. But the main manifestation of cerebral palsy is motor. When we talk about motor, is a sitting, crawling, running, doing all those activities that involve movements and posture. But there can also be other conditions. In other words, the same injury that occur in the brain can also lead to other things apart from the motor part, the movement or the posture part. So in other words, if anybody has any disability and there is no problem with movement or posture, it cannot be cerebral palsy.
Okay.
But conversely, anybody that has a motor, a physical disability, even no matter what else the person have, all those are also parts of the person can still have it as part of cerebral
Cerebral
palsy.
palsy.
I hope
Okay.
that helps.
Yes, ma'am. Yes, ma'am. Okay. Thank you very much for that overview, doctor. Okay. Samuel Adejoke, I believe doctor's overview already answered your question about what could be the actual cause of cerebral palsy. So we'll move on. If that is still not clear for you, you can always send in your question later. But I believe she has captured that. If you have extra question, please send it in later.
Okay,
All
so
right, ma'am.
I think we can begin to take our questions. Thank you to all those who have, all those who are saying good morning, even though we don't feature them, but we can say your good morning. Thank you so much for joining us this morning. Okay, so I think we should just go on to start answering the questions that we have.
Yeah, someone at the Joker is saying, "Good day, doc. What could be the actual cause?" But I
Yeah.
think you already captured that in your overview.
I think so, yeah. So basically is but I want to expatiate on it
Okay, ma'am.
because what I've said may not make sense to most mothers, so most listeners. But basically, in other words, like Tommy said, as we captured in the overview, it's an injury to the brain. Simple. It's an injury to a brain that is developing. That is the key word. And we also say that it is a non-progressive injury. Not, those are the medical jargons when you are defining cerebral. Because there are some injuries to the brain that is going on and on, even as the child is developing. So that is not cerebral palsy. We call those one progressive injuries. But in cerebral palsy, what happens to the brain to lead to cerebral palsy is something that happens once and that is the end. It happens and that is it. But unfortunately, because we've talked about the brain a lot of the time, the brain is one of those organs that is very fragile, very vulnerable. Any injury to the brain that's the end of that part of the brain. The brain is not able to regenerate itself, it's not able to. The brain is an organ that is still developing even after the child is born. And unlike if you cut your skin will grow back and that's it. In the brain, no. So once a child loses part of the brain or an injury occurs to a particular part of the brain, that's part of the brain, that's the end of it. And so now, but the good news is the sense that the brain is still developing and the brain has the what we call plasticity ability. In other words, the brain can some parts of the brain can adjust and take over some function of other parts of the brain, which is a good thing. So that's why some children can actually get better even though they have cerebral palsy. So it really depends on the extent of the injury to the brain. And that will bring me to the before I go into that, because I don't want to lose my train of thought. What are those things that will cause injuries to the brain? Now, remember what I said, that is the injury to the developing brain. So we're talking about the brain of the child when the baby is being formed in the womb, when the baby is being born, and in the first 2 3 years of life. We don't really have agreement. Some people say some people will take up to 8 years, some say 5 years, but at least most people agree on the first 2 3 years that the brain is still developing. So any injury that happened during this period can cause cerebral palsy. So you see some people will tell you, oh, but doc, my baby was very fine at birth, baby was perfectly normal, nothing happened, so how come now my baby is having this problem? So it is not only what happened in the womb or when baby was born, it can be something that happened even in the first 3 years of life. Now, what are those things that can happen to the brain in the womb? Number one, the brain itself will not be properly formed. Malformation of the brain, especially if you are the mother that don't take folic acid, things that the brain needs, or you take a drug that your doctor didn't prescribe for you during pregnancy and it causes damage to the brain, or you are sick during pregnancy. So mothers that have hypertension, diabetes, very complex pregnancy, or what we call high risk pregnancy, their babies are at risk of having cerebral palsy. So those are the things that happen before the baby is born. There are a lot of things there, but those are just examples I can give. Now, the majority of cerebral palsy in our own context happen during that delivery. And it's very important because I know one of the questions people are going to ask me later is how do we prevent cerebral palsy? Now, it was important for us to know how cerebral palsy happens. So most of the things that happen in the womb, sometimes we have little or no control over them. They just happen. But some of them we have control. Like if you are having hypertension, your doctor needs to control your blood pressure. If you're having diabetes, they need to control that. You need to make sure you don't take medications that are not prescribed for you, things like that, and avoid injuries and infections and stuff during pregnancy. Now, during delivery is when most of the things happen. And what happened, a baby did not cry at birth. And this is one of the reasons we say delivery must be supervised, must be taken by trained professionals. So a baby who didn't cry at birth is what we call birth asphyxia. It's one of the commonest cause of cerebral palsy. And that's why you must make sure that when your doctor tell you to CS, please, it is not just that you will not have the baby. People always think, oh, doctor says CS, no, I have my baby, I didn't have CS. That's not the problem. The problem is that you having a baby with an intact brain, or the baby has been born all right, but the baby's brain is not. The brain has been. I've had some injury, so this is what we're talking about. A baby that is born too early, premature babies, that especially if they are born too small as well. In other words, any baby born before 28 weeks and before 37 weeks is preterm delivery. But the majority of those who are born before 28 weeks, those are the ones that are with very high risks of cerebral palsy, or babies that are born weighing less than 1 kilo. High risk, almost 50% of them will have cerebral palsy. Every baby born before 37 weeks, every baby born less than 2.5 kg is at risk of having cerebral palsy. But those who are born extremely low birth weight, below 1 kilo, and very premature, below 28 weeks, are very high risk of cerebral palsy. So these are things that happen during the delivery process, or in the first few weeks of the first 1 week or so of like what we call the perinatal period. Also, babies that have infections, sepsis. Yesterday a mother was asking me on Ask Peter Facebook group that at 4 days old is having fever and she's giving paracetamol and she's asking me what else to give. And I'm like, no, a 4-day-old who is having fever needs to be in the hospital with a pediatrician. That is not a baby you are going to be thinking, maybe I should go and buy anti-malaria. No, in a 4-day-old baby, you should be running back to the hospital because sepsis is one of the causes of cerebral palsy, and sometimes it may not. The only thing baby will have is just that fever, and that's it. And the brain is going. So we really need to be aggressive. Jaundice is another common cause in our own environment, especially because some of us have babies and we discharge. They go home so early. In the hospital where I used to work in Nigeria, we don't discharge baby before 72 hours because we want to monitor them for jaundice. Because most of the babies that have jaundice will have it in the first 72 hours of life. So jaundice affecting the babies, and most people want to do naming ceremony before they go to the hospital, and they will come after the naming ceremony. Baby is already climacteric, the brain is gone, the brain has been damaged by the jaundice. This is also one of the causes of cerebral palsy in our environment. So these are things that can cause, or what we call birth trauma. Some babies, the delivery was so traumatic and all that. So these are the things. But there are also things that can happen after the baby has been born. So a baby who has meningitis, for example, fever, convulsion, and then, severe meningitis can also develop cerebral palsy. Children with HIV and so many other infection generally, even this cerebral malaria, all those things can lead to cerebral palsy. So those are the causes. So anything that happen, all those kind of examples I've given, if they happen to a child and they injure the brain, then that child will develop cerebral palsy. And it's important for us to know those causes because that is what we really need to avoid when it comes to cerebral palsy. Yeah.
Okay, all right. Thank you, doctor. Onoma is asking, okay, no, she's just stating that her daughter is also dealing with cerebral palsy. Okay, Onoma, just keep listening. And if any question pops up in your mind, you can ask on the group, okay? Thank you.
Okay.
Michael.
Okay, Michael is asking a question that is not related to cerebral palsy. I would just advise that you put that question on the group and somebody else will answer. So let's just focus on cerebral palsy today.
And moderators, please, if you see the question doesn't have anything to do with cerebral palsy, give the standard response to that question. Thank you.
Yeah.
Oh, okay. Onome is back again. She didn't finish that question.
Yeah.
Okay? My daughter is dealing with this. She was walking, but she fell sick and went unconscious for 1 month. Then things changed.
Exactly. Wow. So that's example of I really feature on Onome's response because that is example of what we call a post-natal cerebral palsy. In other words, our child was already walking. So our child is already like 1 year old, and then our child became sick, was unconscious. I could suspect what happened to this child. This child most likely had what we call infections in the brain, meningitis or meningoencephalitis, and that is what causes the damage to the brain. So the fact that your baby has been born normal, baby was fine in the womb, that does not mean the brain is over. it can still happen even after the child. So the child was already doing so well, working obviously, and then yeah. So, but we'll talk about it. So yeah. So let's move on. Okay. So I think Pretty has asked this question before I went
Yeah, into your
into
second
the
section of
details
our
because
thing.
yeah.
Yes.
So you want to know how the baby's womb can be it can be injured in the womb. Yes. Well, so when I use the word injury, I'm not using it in the physical sense like somebody punched the baby in the womb. I'm using it in the sense from the doctor's perspective that anything that happens to the brain, I try to avoid using the word damage and things like that. I don't want to use offensive words. So things like insult, injury, we use it when we use the word injury, doesn't mean don't think of somebody punching somebody or any physical thing. It does mean that anything that happens to the brain, that is what I mean. We just classify it as just use the word as an injury. So it doesn't mean it is a physical assault. So any whether it's the infection that affects the brain, whether it's the brain not being properly formed and all that, I'm using that word injury to represent any problem, or let me just say any problem or any insult that happens to the brain. Okay, we'll move on.
Okay. Ellen F. Young, what can we do to help one with cerebral palsy?
Okay, so Ellen is asking me how to. So, but before I go on to Ellen's question, let me quickly tell you, how do you know? Because that's how we normally do in medical jargon. So we talk about I've defined cerebral palsy for you, what it is. I've told you what it is, and I've talked about what causes it.
Crosses it.
Now, how do you know a child has cerebral palsy? Because most time children that have cerebral palsy, they're perfectly fine at that as well. Um, but as doctors, when your baby is born, we can suspect a child who will have cerebral palsy. So, for example, if a baby was born premature, a baby was born less than 1 kilo, the baby was in the neonatal unit we have to breathe for the baby, was going into what we call apnea, will stop breathing, then we'll have to wake up the baby again to start breathing. We already know that this child will likely have cerebral palsy. So we usually will counsel the parent that you need to watch out that your child may have cerebral palsy. So, for example, your baby has a baby has severe jaundice, and we already suspect this. The baby came to us, the jaundice level was like 30. The baby was already having what we call bicycling. It was already doing all those kind of things. We are having convulsions because of the jaundice. We already suspect that this baby will likely have cerebral palsy. So your doctors will know, and sometimes they would have told you that they are suspecting your baby may have cerebral palsy. But sometimes we don't think we may not have those signs. You understand? We may not have those early story or physical signs to tell us this child may have cerebral palsy. One of the commonest thing most parents whose baby will have cerebral palsy always notice is that the children are slow in terms of their motor development.
Okay.
So what I mean by motor development, normally an average baby will start carrying their neck straight at 3 to 4 months. So in other words, when most babies are born, their neck always falls. That's why you have to support their neck when you back them. But by 3 to 4 months, they should be able to keep that neck straight. So the neck should not be falling, left, right, or center like that. So most mothers will tell you by 3 to 4 months, my baby's neck is still flopping. They will notice. Some people may not notice that one because they're always supporting the neck. But most of them will notice that 6, 7, 8 months, the baby is not yet sitting. So they will tell you, doctor, and they will notice all the other babies that were born at the same time, they're already doing those things. Some babies will not walk as 1 year. Those are the mothers that always come and ask us, my baby is not yet walking. And we'll say, okay, let's wait until 18 months. So after 18 months, baby is still not yet walking. Or even by that 18 months, baby is still not yet even carrying the neck. Talk less of sitting. So when you see the signs of motor development, of delay motor milestones, you suspect cerebral palsy. Some babies also will become very stiff. They have what we call hypertonia. Their body will be very stiff. So most babies, their hands are born fisted. But by 3 to 4 months, they should start opening their hands most of the time. And that is when they can grab rattle and shake rattle and all that. But you see some babies, they always like that. Even when you want to drag their hands down, it's always very stiff. They have what we call hypertonia. So these are all those other signs. Some babies may not have hypertonia because we have different types of cerebral palsy. I forgot to mention that. So maybe they're only they will be having some restless movements. They will just be, they are never still. They will be having movements. Some babies will also have other things that could be actually. Remember what I defined cerebral palsy? That the main thing in cerebral palsy is that motor difficulties or motor disability. But the other features, because it's a brain injury, other things that happen to the brain could also manifest. So some babies will have convulsions. They'll be having seizure, not seizure with fever. They will be having seizures without fever. Some babies will be drooling saliva. Some babies will have, they may not be able to see. Some babies may not be able to see. Some babies may not be able to hear. So how do you know a baby is seeing? Most babies should be able to track their mother with their eyes. So when you move, you see them following you with their eyes. But when some babies, they don't follow. Even when you move things in front of them at 3-4 months, most babies will want to grab it. If you see the baby with cerebral palsy, they don't follow it. They may not grab it. You start having concern. So basically, also start noticing that this child development is slow, or this child is showing some signs that you are not sure what it is, then that is when you need to come and see. Those are signs of cerebral palsy, and those are the times you need to come and see a pediatrician. All these signs can also occur in other conditions, but it is when we take the history, we examine the baby, then we can confirm cerebral. So we confirm cerebral palsy by the fact that the history of what happened before the baby was born, when the baby was born, after the baby was born, and the physical evidence. Sometimes we from the history, mom will tell us everything was perfectly fine. So we know that, could it be that something happened in the womb that we cannot see? So that's why we need to do tests. Sometimes we want to do a brain scan and all those kind of tests to know, is the brain properly formed? Because some of the time when we don't have those kind of histories, those ED1, maybe the brain was not properly formed and all that. So those are the things that we will do first. So when we know now cerebral palsy, there are different levels. So when we talk about cerebral palsy, there are people with cerebral palsy who will be lawyers, who will be doctors. So I always give example of my friend Toby. She's a lawyer, she's an author, and she's a disability advocate. So, and she still has cerebral palsy, but she's doing every other thing. I mean, she's doing what every other person will do, even more. But you also have people with cerebral palsy who will never walk. I know most mothers always ask me, will my child walk? That's what mothers want to know. But the honest truth is some children will never walk. So somebody like Tommy we'll call them what we call mild cerebral palsy, or those who have what we call level 1 or level 2 cerebral palsy. But you see some children, they are in wheelchair, they will never walk, they will never talk, they may never be able to do, they will always need other people to do things for them all their lives. So those are what we call level 5 cerebral palsy, or the severe kind of cerebral palsy. So what we need to do is to know which level your child is, and that was what will determine what help the child needs. So some children will even walk, even though that's why they have cerebral palsy. Just that they may not walk very easily. Some of them may need like crutches. Some of them may need extra time to, those kind of things. Or some people, they may need to have surgery for their legs and stuff, but they will still walk. But there are some people that we need to just get them wheelchairs. So in terms of management of cerebral palsy now, is to know what are the challenges this person have. Sometimes the problem that is really disturbing somebody with cerebral palsy is not even the cerebral palsy in quotes itself. In other words, the physical aspect of the disability, because the physical aspect of disability is very easy to handle. Honestly, if person can walk, we're fine. If person cannot walk, we can give wheelchair. And this day we have motorized wheelchair. But the majority that many people, the main challenge people have is that same problem that causes the physical disability may also cause what we call intellectual disability, may affect their communication ability, may be causing epilepsy. So sometimes it is the seizure that is even the main problem. In other words, this child is having convulsion all the time and we can't control it. Sometimes it's the fact that the child cannot communicate that the parents worry about. So I'm sure you've seen people in wheelchair who can talk, I've seen people in wheelchair who are like stockbrokers, very rich, very, very brilliant. So the physical disability to me in cerebral palsy is even the least of the problem. The most the other things are what we call associated conditions in cerebral palsy, especially the intellectual aspects. the learning ability to learn, or having things like cerebral palsy or all those things, those are the ones that actually limit a lot of people with cerebral palsy, and those are the things they really need a lot of help with. All
All
right, so
right.
I'll stop there.
Thank you, doctor.
We can go to
Thank
the
you, doctor.
question. Yeah.
Okay, let's move on. Okay, Onome, okay, Onome is completing a sentence. She says the doctor said her daughter's one is called
Yeah, I think
cerebral
I've left it on
paralysis.
me. Okay,
Okay,
can you see this one by Conqueror?
Concra, can molding or mopping of heads at birth cause it?
No. No, molding is not the cause of cerebral palsy. Now, molding, but I need to explain further what you're saying, because it's very important. Now, molding on its own is not, so molding, for those who don't know, is like when the baby is being formed, because the birth canal sometimes is narrow than the head. The head is like forcing its way through it, so it can swell up a little bit. You can have all those kind of things that, and usually those one will resolve. But that excessive molding of the head could also suggest to us that delivery was quite difficult. And when the delivery is quite difficult, it may mean that baby didn't cry
At
very
birth.
well at birth. And so it is not the molding of the head, it is the not crying, or what we call asphyxia. Or some people say, my baby cry, but how did the baby cry? Is it cry weakly? And that is it. And the baby is not breathing, or the baby needed to be given oxygen and all that. So if your baby needs to have so much of resuscitation at birth, so those are the kind of babies. So the molding on its own, many babies have mold, most babies will have that and they're fine. But if the baby has molding of the head and the baby also has asphyxia, then that is when we worry about cerebral palsy.
Okay.
All right.
Michael Rachel, I think you should wait till the end of the video, then watch it all over again. Your question has been attended to. What can we do to avoid already born like 3 months to 3 years?
If your what do you mean by avoid? If your baby
To
is already,
avoid
if
having
your
cerebral
baby does
palsy.
not have cerebral palsy already, okay, yeah, I know I need to answer his question. Yeah, because I already said that this can happen later.
Later, yes.
So the way to avoid it is just the same thing we do for every other thing with children. You need to make sure your children is having good nutrition. Make sure they take the immunization so that they don't have the commonest cause of postnatal meningitis is infection. Meningitis and postnatal cerebral palsy is
Meningitis.
meningitis, encephalitis, infection in the brain. So, like what one of the moms said, that her baby was doing fine, then Ad was ill and Ad was unconscious for 1 month. That is infection in the brain. Infection in the brain is the commonest reason. So, if you need to avoid that, and how do we avoid that? Making sure we take care of our babies, good nutrition, so that their immunity to fight infection is high. Make sure you get immunization. Immunization will prevent some of those infections. We have immunization against meningitis. We have pneumococcal vaccine. We have, what are the things that cause meningitis in children in that ages? Pneumococcal bacteria, meningococcal bacteria, and HIV bacteria. Those are the commonest cause of meningitis. Good news, we have immunization against all those bacteria.
All of them.
So we need to make sure that our children, initially pneumococcal was so expensive, but now it is free. We give it free. So thank God. Meningococcal, I think, is not yet free, but in some part of the country, like the north, where it is they
Endemic.
have that. So I think sometimes they just give it like that. Even measles, because malaria is also another thing that it's really cerebral malaria. So that is why when your children are ill, please take them to the hospital on time. Don't be waiting. Don't be doing doctor on your own. Take them to the hospital on time. So those are the ways. And of course, avoiding head injury. Also, if a child has an accident, for example, so make sure when the children are in the car, they wear their boosters, they sit on the booster seats. Most Nigerians don't do that. Children below 1, 2 should actually be in the car seats. Children above that age should have a booster seat, so that, and make sure they put on their seatbelt. It's very, very important. Don't put children in the front of the car, because those are the things that can also happen. Accidents, injuries that can affect the brain. So those are the things that you can still do in children that's already alive. I mean, who already escaped the prenatal and the perinatal causes.
All right. Thank you, doctor. Okay. Odabumi Diary is asking, what about seizure with a baby with cerebral palsy, ma?
Yes, yes, I've already said it that it's one of so cerebral palsy is the physical aspect of the disability, but the same problem that causes cerebral palsy, the injury to that brain, the insult to that brain, can cause so many other things else. And
Things.
seizure is one of we call them associated impairments or associated diseases, if you like, that can come. In other words, not everybody with cerebral palsy will have seizure. You don't need to have seizure for you to say you have cerebral palsy. But let's say 50% of those who have cerebral palsy will also have epilepsy. Some of them we can easily control them with medication. So you need to be seeing your pediatrician or neurologist and they'll be writing the medication for you. Some of them they could be very difficult to control, very, very difficult to control. Some of them we try other things like even surgery at times just to control the epilepsy. So and it's so hard for them because there's already something in the brain causing the epilepsy. So sometimes they even have to, the surgeons sometimes have to take it out if they can't control the seizure. But most of them we can control with medication. So that child needs to be taking uh, drugs for seizures.
All right. Thank you. Adewumi Uyeyemi is asking, are there similarities between among Down syndrome and cerebral palsy?
Oh no, the so I think I started the at the beginning to explain Down syndrome and cerebral palsy. Now, but it's possible for a child to have the two. In other words, a child can have Down syndrome, have cerebral palsy, but it's not.
Wow.
So yes, for example, if a child with Down syndrome had a heart problem and needed surgery, and maybe during surgery, enough blood didn't get to the brain on time and all that, the child can still develop cerebral palsy. But majority of the time, cerebral palsy is more of it's a genetic problem that can come with mostly intellectual disability,
Okay.
mild to moderate intellectual disability, whereas cerebral palsy is more of a physical disability. But somebody with cerebral palsy can also have intellectual disability. In other words, there are things that overlap between the two, but they are not the same. So in Down syndrome, their problem is in the genes. They have an extra chromosome 21, and that is what is causing the intellectual disability. It has not, and you can see the way they look. They look in a certain what we call they have the distinct features. You know,
Yes.
there's a way people with Down syndrome look, whereas
Look.
people with cerebral palsy don't have any special look. Some of them may have a smaller head because the brain didn't grow very well.
Oh, well,
Yeah,
okay.
because when the brain suffers an injury, that part of that brain stop growing. And one of the features is also seen in cerebral is that their brain is not growing very well. So they have small head, or what we call microcephaly. So, but other than that, the fact that intellectual disability can occur in the two of them and all that, they are two different conditions and they are not. And I know that it's a major challenge for us in Nigeria because every disability, people just group all of them as
Yeah,
one. So
one, yeah.
people are saying everybody is Down syndrome, even when the child doesn't have Down syndrome. Or they are saying it's cerebral palsy when the child maybe it's Down syndrome, they call it cerebral palsy. And it's because at the beginning they may look alike because at the beginning all the children will be slow with their development. But eventually, children with Down syndrome will walk, they will do anything, they will not have any physical disability in terms of they will not be needing wheelchair and all that. Most of them will do their walking, most of them will do everything by themselves. They may be slow, they may take them some time to get there, but they will eventually get there. And
Do it.
usually, they are not stiff, they are actually very floppy in Down syndrome. They are very, very floppy, they have what we call hypotonia. Whereas people in cerebral palsy are stiff, they are
Okay.
very spastic or what we call hypertonia. So they are not the same thing. The only thing that tends to overlap in the two of them is some of those intellectual
Child
disability.
disability
But it
is
is so in other words, it's not compulsory a child with cerebral palsy will have intellectual disability. But
okay.
majority of people with Down syndrome, we have, even if it is mild, they will have some mild intellectual disability.
Okay. All right. Thank you, ma'am.
Yeah.
Ifewulu Stella is asking, can it be cured or corrected?
Okay, so like we said, it depends on the cause. It cannot be cured. I mean, let's because people always ask curative questions. Let's just settle it at all. In other words, once somebody has an injury to the brain, that injury is permanent. We cannot do anything to reverse that injury. We're doing a lot of research now. People are talking of genetic gene therapy and all that. a lot of people's research is ongoing, but as at this morning,
Yeah.
there is no cure for
Cure
cerebral
for cerebral
palsy.
palsy.
So because it's an injury to the brain, that injury cannot be reversed, cannot be cured. It is final and it is permanent. But the difficulties that somebody with cerebral palsy has can be overcome. In other words, so somebody with cerebral palsy who have stiffness in the leg, for example, there are things we can do to remove that stiffness. Okay, and some of them will give them what we call Botox injection, some of those things, and they may be able to walk and do all those things. Some of them will not be able to do that. We can give them aids or assistive devices. So somebody with wheelchair, somebody who cannot walk, we can give them a wheelchair. Somebody who cannot talk, this day we are teaching them what we call augmentative and alternative way of communication. So they just need to press a button and something will talk for them and all that. So there are lots of technology support. And so in other words, the person may not have an handicap, what we used to call an handicap before. In other words, you could have a diagnosis of cerebral palsy, but that may not stop you from doing anything you want to do.
Okay.
So you are not really disabled in the sense that you can still do anything you want to do. In other words, so you can get all the right support, but the original physical injury in the brain, we cannot do anything about it. And so, what are the? I will, if we start saying, what are the things that we normally need to do? No, the first thing is early diagnosis. We need to know, the earlier we make that diagnosis, better. Majority of children with cerebral palsy should be diagnosed by the time they are 1 year old.
Okay.
Some of them will even, like those one, like I told you, that we suspect that they will have it. Since we already suspect it, we'll start treatment. What are those things we normally start? Physiotherapy is very key, is one of the cornerstone of management of cerebral palsy. So physiotherapy. If a child is not talking, a child will need speech therapy. If a child has difficulty with using their hands, they will need occupational therapy. If a child is having seizure, we will give drugs for seizure. If a child is too stiff, we have what we call muscle relaxants, medication that we can give to make their body softer. Some of them can be oral drugs, some of them can be injection like Botox. Some of them we have to do surgery for some to release some tightness of the body. So there are, and the management of cerebral palsy, I forgot to mention that it involves so many people. It's a multidisciplinary management. So we have the key person who coordinates everybody is the pediatrician, usually the pediatric neurologist or the developmental pediatrician. So because there are so many professionals that will be involved in their life, so it's important that there's one person who is like the main coordinator of care. So usually the pediatrician, pediatric neurologist, or developmental pediatrician. But they will need at one time, they may need neurosurgeons, they may need orthopedic surgeons, they will need physiotherapists, they will need occupational therapists, they will need speech therapists, they may need dietitian because some of them also have problem with their eating, keeping food down and all that. They will need different nurses, they will need different professionals, orthotics, protectors, those are people that make those special equipment for them. So they will need all those people at one point or the other in their life. Okay. All right. I hope that is helpful. So the most important thing is that once a child has that diagnosis, that child is taken to the hospital and start the support that the child needs.
All right. Thank you very much, Dr. Bemi. I don't think we have any other question pending.
Yeah.
People, ask your questions.
So we have 15 more minutes.
We have 15 minutes to go before the broadcast ends.
Yeah. So while we're waiting, thank you, John, for Ellen, for your feedback. While we're waiting, I just need to give you some take-home messages. About cerebral palsy. Right now, they said about maybe 17 million people living. So cerebral palsy is something that occurs worldwide. So it's not only a third world problem. Because despite the fact that we've been doing, even in those countries where they've had a lot of technology advancement and they prevent things like deaths of children. I'm wearing green color today because green is the color for cerebral palsy, by the way.
Oh, okay.
A lot of them, still have children coming down with cerebral palsy. So places like US, Canada, and Australia, where they are like developed countries, UK, and but they still have children with cerebral palsy. So in other words, it is not all cerebral palsy that are due to, like in our own case, preventable causes. But there are six, even in developed countries, they still have cerebral palsy. Most of their own cerebral palsy are due to the prenatal causes, things that they cannot do anything about. So a child was born premature because their brain is so fragile, so they can easily bleed in. Even just carrying them, their brain can start bleeding. So I mean, it's so difficult. So they also, they have their own cases of babies that are born with brain malformation. Sometimes we have no control over some of those things. So don't look at children with cerebral palsy or their parents, or maybe they were careless or these, that's why they try. No, there are some cases of cerebral palsy that, to be honest, we cannot prevent it. And even you would have thought that those places where they have very advanced healthcare services and all that, that they shouldn't be having cases of cerebral palsy anymore, but they are still having it. But maybe it's a little bit stable. In other words, it's not increasing. That is number one. So, but the good news is that at least those ones that we can prevent, let's prevent them. At least let's reduce it to those ones that we have no control over. So what are the ways we can prevent them? I know we've alluded them, but these are the take-home messages, especially for those who are pregnant and those who are planning to have babies. Number one, be ready for pregnancy. Also, we don't want too young and too old mothers are prone to having difficult pregnancies, and difficult pregnancy is one of the commonest reasons that child may end up having cerebral palsy. So please don't get pregnant before you are 18. When you are 18, you should be in university studying, become a pediatrician, become a computer IT person like Tommy. That is not the time to start having sex, getting pregnant. And I'm being serious there. So for those who have young teenagers, please let's encourage them to focus. And so when they are ready from 18 plus, yes, they can have the babies, because their pelvis is more matured for a baby to come through. And most of the teenage mothers, they end up having babies with cerebral palsy because it's always a difficult or traumatic delivery because their body is not ready. That's the honest truth. And of course, we also want you to have your baby early, not too old as well, because it can also be traumatic. Two, when you are pregnant, I know Nigerians, I always say this all the time, we don't plan for pregnancy, but it should be nice to start planning before you get pregnant. But even if you know you don't plan, but you're already married and you know pregnancy can fall on you anytime, please take your folic acid. Folic acid is good in preventing those brain malformation. Remember what I said, brain malformation is also one of the things that can cause cerebral palsy. So take your folic acid, go for antenatal. And when you go for antenatal, it's not to go and gist and joke with the doctor. Make sure they check you. Make sure they check your blood pressure. Make sure they check your urine for blood for diabetes, sugar. So that if they pick it up, they will. And when they pick up those things, please let them send you to the specialist. Let them send you to the gynecologist obstetrician, because those are the people that can manage high-risk pregnancy. High-risk pregnancy is not for a midwife. It's not for ordinary doctors. It's for the specialists to manage so that they will determine. And please, when the doctor has decided that your baby needs to be delivered via CS, please don't say you are an Hebrew woman. In Nigeria, this is one of the reasons our babies end up having cerebral palsy. Don't be a funny Hebrew woman. It is God that gives the doctors wisdom to do cesarean section. The most important thing I always tell mothers is that you are alive and your baby is fine. Whether it is a vagina or cesarean, it doesn't matter. It is just one scar. And the way we do it these days, nobody will know. Trust me. You will wear your bikini, nobody will know you've had a CS, because that is another reason some people don't want to have CS. It is a lower, they do it in that lower part, which is covered. There is nobody will know. So don't be scared. And it's better you are alive and your baby is alive, and you don't have to start dealing with going to all these multiple appointments. You see all the multiple professionals that I say you'll be seeing, and in some countries you really need a lot of support. In Nigeria right now, we don't even have those social welfare support for somebody who has disability. We are working there, and thank God for Lagos State government. They've been doing quite a lot for people with disabilities, but we are still really far from what we should be getting. So please, prevention for us is still very, very important. And when your baby is born, please, like what we always say in ATP, make sure you do all those promoting things for the baby. Breastfeed your baby, take immunization, do all those things. If you notice anything, please, in newborn babies, anything you notice, please, please, please don't form doctor. Take that in newborn baby, don't even take them to ordinary GP. Take them to see a pediatrician. I'm very, very serious about that because most of them sometimes they may not be able to handle a newborn baby. A newborn baby needs to see a pediatrician. Your baby is having fever, take them. Make sure your baby is checked for jaundice. It's always so painful when babies have jaundice and they have cerebral palsy because we can prevent it. Jaundice is so easy to treat. We know what to do. But when you come to us, when the jaundice has already gone into the brain, there's nothing we can do. Whether you do anything or you don't do anything, whether you give proper water or you don't give proper water, jaundice is still going to go away. That is not the problem. I always tell mothers, the jaundice is not the problem. The jaundice will always clear on its own. But exactly, but what damage has it left before it will clear? It is that brain damage that we're trying to avoid. When you see us being running scatter over jaundice, it's not because jaundice is our problem. It's because we don't want it to get into the brain. Once it gets into the brain, that is it. We can't do anything about it. Even if you come to us, we will change the blood. We'll do all those phototherapy, but we know it is medicine after death. So please make sure your baby is checked for jaundice. If your baby has jaundice, please let nobody tell you it will clear. Let them take blood. I can't remember how many times mothers have told me my baby have jaundice. I took them to hospital. They just told me to go home. What kind of nonsense is that? They must take blood to know the level of that jaundice. It is that level of jaundice. There's a level of jaundice I'll tell you, go home and keep on breastfeeding. There's a level of jaundice I'm asking for blood that I need to change this baby blood right away within 1 hour. It is a level. So how can you go to the hospital with a baby with jaundice? Even me as a pediatrician, I cannot rely on my just checking. Look, that is why we have tests. We can't rely on our own. Some babies are very fair, so they will think they are just being fair. Whereas it's jaundice. Some babies are not so dark, you won't even know they have jaundice. Sometimes you see us taking the baby to the outside just to check for jaundice, and we have to take blood. So all these people going to hospital and they will take, and then those hospitals where they will take blood for jaundice and they will have you to come back in 3 days. Please, if they take blood from your baby and they will not interpret that test, especially if it's for jaundice, if they will not interpret it within 2 hours, maximum of 4 hours, please take your baby to another hospital. That is not a deal. I've seen it. This is not story. This is something that I've seen. A mother came to me when I was in Lausanne, and her baby has cerebral palsy. And baby had jaundice. Mother went to hospital. They took blood for jaundice. They took her to come back in 3 days. What kind of nonsense is that? By the time the baby will come back in 3 days, the jaundice was so high. And the baby, they did EBT and everything, but the baby already has cerebral palsy. So these are the things that we really need to avoid. And please, when our children are sick, take them to the hospital. I know this, I sound so passionate about it because that is my field. That is what I deal with. Unfortunately, I'm the one, whether fortunately or unfortunately, I'm the one that deals with that is my field. I deal with children with physical disabilities, and I don't mind that, but it's very, very painful when we have to deal with things that we could have prevented. And what I'm telling you today are from life experiences that I've dealt with. They are not stories people told me. These are patients I have seen. These are stories I have heard. So I hope we have learned and we will not. Okay. So I think I have 2 more questions.
Yes. How can we treat sleeping disorder in cerebral palsy?
Yes. So children with cerebral palsy, like other children with disabilities, can have sleeping difficulties. So usually what we prescribe, we give them melatonin. So you need to see your pediatrician. They will give you medications that can help the child with sleep. But there are many reasons why they don't sleep. I don't want to go into all that. It could be that they're in pain, because their body is stiff. Sometimes it could be a form of a seizure. So you will need to know, and because the children sometimes can't talk, so people don't know what is wrong with them. They don't know where. Maybe it could be something as simple as maybe their nappy is wet. For those who are still in diapers. So you need to do a lot of triaging. Why is this child not sleeping? Make sure that they are dry, they're not wet. Make sure their body is well. You are massaging. There's not that they're in pain and all that. But if they're still not sleeping, if it's just because they can't just sleep, then we can give things like melatonin, and that can be helpful.
All right. I think this is our final question
Final
for the
question,
day.
yes.
Odebumi Diary is asking, what is the cause of recurring seizure and the prevention of a cerebral palsy child who has been standing through lots of therapy and find it difficult to stand again, ma'am?
Yeah, so yeah, what you said is right. The reason why that child is finding it difficult to stand again because the seizure, you see, a child with cerebral palsy already has brain injury. Now, when the child is having seizure, you know what happens during seizure is that the child is convulsing. During that process, oxygen is also having difficulty to get into the brain. So the uncontrolled seizure can worsen the child's difficulty. In other words, it's causing more brain damage. That's what I'm saying, and that would be the reason why the child seems to be losing instead of going better. Actually, children with cerebral palsy, they always get better, they don't get worse. So if a child with cerebral palsy appears to be getting worse, you need to see your pediatrician because there may be something else going on. Usually children with cerebral palsy, they only get better, they don't get worse because the brain is developing. And so, no, they don't recover the part of the brain that is lost. Remember what I said earlier about the brain. There's still some plasticity of the brain. Brain can still try to take over some other parts of the brain can take over the function of the part that is, and that's why therapy is important because what the therapy does is that it stimulates the brain to keep doing more, and that may help. But like I said, it depends on the extent of damage in the brain. So this child seizure is a problem, Mr. Odebumi, and we really need to control that seizure. And the number one, the common reason why seizures are not controlled is either we're not giving the right medication or we're not giving it in the appropriate doses. And I know some doctors are so scared of the dose of medication. So these are things for a specialist. So this child should be seen by a pediatric neurologist or a developmental pediatrician who knows how to manage epilepsy. I've seen children when they come to my clinic then in Lutz, I mean, they've been on phenobarbital forever and they'll be giving one tiny dose, of course. And we have so many drugs. I'm not saying there are no seizures that are difficult to control, even for those of us that are the specialists in that field, we still struggle at times, but at least let's make sure we've explored all the possible. Some of them, just starting them on things like Tegretol or Epilim, and at the right dose, the seizures ended. And the good news is that they don't have to have seizures for life. Sometimes after a while, we can stop the medication as well. We begin to reduce it. Like if the child has not had seizure for 2 years, sometimes we reduce it, and some of them will not have seizures again, and we can stop the medication because sometimes parents worry. And please, but don't stop it by yourself because that's another thing parents do. They will just stop the medication on their own. No, we don't want you to stop it by yourself. Let us be the one to tell you when to stop. Because when we also want to stop, we don't stop suddenly. If your baby didn't have seizure for 1 week, it does not mean you should stop medication. You still have to take that medication for like 2 years. After 2 years, when we want to stop it, we also don't just stop it, bam, like that. We gradually reduce it, and that's how we deal with it. All right. So I think that's our last question. That's where we'll be ending for today.
All right. Thank you very much, Doctor, for your time today. I believe everyone has learned about cerebral palsy today. And yes, on behalf of Ask the Pediatricians Foundation, I want to appreciate everybody that contributed to our Match Accelerator on Global Giving. Thank you. It ended yesterday from March 11 to March 29. You guys were a great support.
Thank you.
Don't forget, next week Saturday is another opportunity to learn and ask your questions on another topic. So please make it a date, 10 a.m. next week Saturday. Dr. Gbemi, any other?
Yeah, just to say that we want to thank them once again for joining us, and to say if you still have questions, because I can see somebody additional is a regular, but she's just coming. But we are not talking measles today. We're talking cerebral palsy. So you know where to do. Go to the group, and you can drop your questions directly on our Facebook group. Like I always say, we are there 24/6, not 24/7, but we are not there on Sundays, and we'll be very happy to answer your questions. So if you have any question, please don't drop it under the video, because once we are done now, we will not be here our moderators will not be here to attend the questions dropped under the video. But go to our Facebook group, drop your question there and we will answer your question. That is number one. Number two, beyond what we do on Facebook, ATP Live, ATP, our Facebook group, we also do community medical outreaches. And our next outreach is coming in May 2019. And we would really love to, if you really appreciate what we do, we would like you to support us. And there are many ways you can support us. For those of you who are in Nigeria, you can just put in your money. You can just donate directly. I'm looking for our account details. Yes, so you can just donate directly onto our Facebook group, and sorry, our Asbjudge Foundation account, and you can see the account details there, Guaranty Trust Bank, and we'll always acknowledge you. And just know that whatever you give to us on Active Pediatrician goes directly to the children. We don't pay our volunteers, we don't pay our doctors, we don't pay for anything. We use every single kobo for the outreaches and for the children. So you can trust that your money is being used judiciously. And if you are outside Nigeria and you can't easily transfer to our account, you can give to us on Global Giving. Just like Tommy said, we're now a permanent member of Global Giving, which means that you can always go to Ask Foundation page on Global Giving, and you can pay with your card. You can always give to us over there as well. But if you go to our group, you will see the link. Or if you ask us, you can email us. We'll definitely send it to you. So that's just what we want to say. We would love you to be part of us. We'd like you to be our partner, and not only online but offline, because our goal is to reduce and possibly stop unnecessary deaths of children as a result of ignorance. So thank you so much.
Thank you very much, Doctor. All right, bye everyone.
Bye. Yeah, have a wonderful Saturday. Bye.